Glaucoma doesn't just affect your vision. It can also impact your mental health. I have seen it, unfortunately, in countless cases in my practice. But what is the impact on mental health and what can be done about it? Hi everyone, I'm Dr. Saya Nagori. I'm a board-certified ophthalmologist and a glaucoma specialist. And on this channel, you're gonna learn about exactly how to keep your eyes healthy, different eye products, and also research that's being done in the field of ophthalmology. I am very passionate about people knowing that glaucoma is the silent thief of sight, and it is a very treatable condition. So make sure that if you're watching this video that you've been screened for glaucoma, and if you haven't been, please go get your eyes checked because it's a very treatable condition. Now, let's get into the topic of this video, which is glaucoma and mental health. Now, unfortunately, people with glaucoma may feel anxious, depressed, and having this diagnosis can severely impact a person's quality of life. In addition to the feelings of anxiety and depression, there is also a relationship between stress and glaucoma. All three of these, stress, anxiety, and depression, may not only be caused by glaucoma, but it's possible that they could make the disease worse. But why is this? So there is actually a research study that looked into this. It was a smaller study, so definitely more research is needed. But having glaucoma can increase stress for some patients. And at the same time, if stress contributes to the progression of disease, this can become a very vicious cycle for patients. Now, scientists do not fully understand how, but there is some research to suggest that anxiety might affect our nervous system in ways that can influence the progression of glaucoma. Now let's talk about the study that was done. Researchers studied 251 glaucoma patients over 2 years to see how anxiety and depression would affect their disease. Researchers used the Beck Anxiety Inventory and the Beck Depression Inventory 2 to measure mental health levels. The key findings in this study were that people with high anxiety were more likely to have eye bleeding, also called a disc hemorrhage, higher eye pressure, and faster nerve fiber loss, which is also called RNFL thinning, or retinal nerve fiber layer thinning. Also, people with high depression experienced worse vision loss on their visual field tests. Now, it's very important to remember that there could be confounding factors, which means that it may not be the depression that's making the glaucoma or visual field worse, but it could mean that the depression is causing the patient to have low energy and put less effort into actually taking the test, which could make the test appear like it is worse, but it's not actually a worsening of glaucoma. Now, this can be problematic because as doctors, we use this data to determine how we treat glaucoma patients. So if we think that our glaucoma patient is progressing, we may want to be more aggressive with their treatment. And so if this test is being influenced by mental health like anxiety and depression, we certainly want to get an accurate assessment of how the glaucoma is really doing. And this is why treating mental health disorders that exist with glaucoma is so important.
Another study published in 2020 in the British Journal of Ophthalmology also found a link between patients who were called glaucoma suspects and depression and anxiety. The results showed that having anxiety at the time of being labeled a glaucoma suspect was linked to a higher chance of being diagnosed with glaucoma in the future. If depression was combined with anxiety, the risk of developing glaucoma was even higher. The study suggests that anxiety could be a warning sign for future glaucoma, rather than only being a reaction to the disease.
So of course, further research is definitely needed, but these suggestions that anxiety and depression could speed up glaucoma progression are definitely concerning. And it's understandable because being diagnosed with glaucoma is scary. Patients worry that they're gonna lose their sight, they worry that they could be dependent on others, and they worry that they're gonna have to make major changes to their lifestyle. This stress can be present in any stage of glaucoma, even if it's diagnosed early with good visual potential. People in the early stages of glaucoma glaucoma could feel anxious, especially if they have witnessed a family member who has glaucoma, who has unfortunately not had good visual outcomes. And when you see loved ones go through that kind of trauma or having severe visual loss, that can definitely impact your outlook on your disease. Another huge mental health impact of glaucoma is the daily reminders about your disease and also the treatment burdens. For many people, beyond the stress of possibly losing their vision, it can be a daily burden and difficult to take multiple eye drops a day. And for patients who take eye drops 3 times a day, they may have to carry around their eye drops to do all their tasks and run their errands. And this is definitely something that's pretty annoying. Most other medications for other diseases are usually only dosed once or twice daily, so those medications can typically stay at home. Also, putting eye drops is not easy for a lot of patients. They often feel like they're missing their eye, which can further add to stress and anxiety because then they're not sure if they're actually getting the medication into their eye. This is where having a family member present can really be helpful because they can ensure that the medication actually got in the eye. They can also serve as someone who can help them remind their loved one that they need to take their medication, and that way the burden of the disease does not just rely on the patient themselves. Other ways that mental health can affect glaucoma treatment is when it comes to following treatment plans. Patients who have depression or anxiety may want to skip their appointments, or they may stop taking their medications, and both of these are actions that can worsen their glaucoma. This is why, again, addressing any mental health problems can improve both eye health as well as the overall quality of life of someone who is living with glaucoma. Now, certain patients with glaucoma fall into a higher risk group. These patients include people who live alone, anyone who has a limited income or limited resources when it comes to medical equipment, and anyone who struggles with any kind of substance abuse. As we get older, we know that social isolation is something that becomes a problem, and older individuals who are living alone often need to rely on their loved ones to help them, remind them to take their medication, or they may need help getting to their appointments. This is why having a support system, in addition to professional help when it comes to your mental health, can be really impactful in helping you manage your glaucoma disease. Another big concern for people is the fear of falling. Research shows that people who have peripheral vision loss are more likely to be afraid of tripping or missing curbs, especially in busy places like New York City or Washington, D.C. This fear can actually make people stay indoors, which can then perpetuate a cycle of more isolation and more loneliness. So if you're someone who's been feeling this way, or you notice a loved one has been feeling this way, you should really talk to your primary care doctor or a psychiatrist about the mental health concerns. Because if it's not addressed, it could become a vicious cycle, because a glaucoma diagnosis on top of an existing mental health disorder can cause a lot more stress, anxiety, and depression. However, by recognizing and addressing these challenges, glaucoma patients can improve both their mental well-being as well as their eye health. Hope you found this helpful. Remember to hit the like and subscribe button below, and let me know in comments if you have any other questions about glaucoma. Thanks for watching.